like to introduce tonight's speaker. Uh, Chanchal Cabrera specializes in healing with plants. She's a medical herbalist who has practiced for more than 40 years with a specialty in holistic oncology. She's the author of Holistic Cancer Care, an herbal approach to preventing cancer, helping patients thrive during treatment, and minimizing the risk of recurrence. She teaches at the Boucher Institute of Naturopathic Medicine in British Columbia, Canada, and she lectures internationally on medical herbalism, nutrition, and health. Chanchal is also certified in forest bathing, a certified master gardener, and a certified horticultural therapist. Chanchal lives on Vancouver Island in British Columbia, where she and her husband manage a 7-acre internationally registered botanic garden specializing in food and medicine plants. So it sounds perfect, and I look forward to hearing her tell us all about how one can forage in the pharmacy that is around us. Thank you.
All right, I think that's my cue. So let me share my screen. You know the ropes, guys. Give me 1 second. All right, thank you so much for that introduction, and thank you so much for all the inspirational work that you folks are doing out there. You sound like my kind of people. Um, and of course, we find each other, don't we? The plants bring us together. And in this case, I am coming in from Vancouver Island. It's uh, late afternoon here, a little later for you, I think. And you had my husband speak to you not that long ago, Thierry Vrain. And so now you've got me. And you can imagine that we have some interesting dinner table conversations, he and I. So yeah, as Tim mentioned, I'm a medical herbalist. So I do run a private practice here, 41 years in clinical practice now, seeing patients and guiding people to better health through diet, lifestyle, food choices, activities, and herbs. Herbal medicine is part of a continuum for me. I don't really know how to differentiate between rosemary in the garden with its beauty and rosemary in the kitchen with its amazing flavor and rosemary in the dispensary with its impact on circulation to the brain, memory, cognition, and so on. To me, those are all aspects of the same thing, really. And I'm very privileged to be able to work in all of those because I am a horticulture therapist, but I do work with individuals in the gardens, but it's in my own gardens here in the botanic garden that we run here, growing the medicines that then serve the clinic. And so it's all sort of woven together for me. And the forest therapy, I have trained in Japan, in Shinrin-yoku, and I'm currently enrolled in a program through an EU-funded program, actually, FT Hub, Forest Therapy Hub, which is a practitioner training as a forest therapy professional. So I'm in school right now doing that. Yeah, perennial student, right? Aren't we all? So Innisfree Farm, where I live with my husband Thierry, our logo here, as you can see, is growing wellness. So that is essentially what we try to do here. We grow food and medicine for ourselves, for our community, and for the clinic. And I would suggest to you that as much as we know about growing food being a really important part of really of sustainability and self-sufficiency, that there is a real sense of comfort and relief for me when I have plenty of food in the garden and plenty of food in the pantry. And I know that I can grow more, and that feels like a very nurturing and very safe thing to do. But I wonder how many of you have thought about medicine in that way. So we know that we shouldn't be buying strawberries in January if we live in the northern climates. We know that agriculture, big agriculture, is a problem in the environment, and we make our food choices accordingly. But the medicines that we take are petrochemical derivatives. Yes, maybe once they were plants or inspired by plants, like aspirin maybe did come from willow way back when, but honestly today they're petrochemical derivatives, about 80% of them. And they're manufactured in China and India and shipped over here, and they're not getting through right now. So what are we doing for some of our medicines? And is that a sustainable strategy? Is that a good way forward? For me, as much as I think about the carbon footprint of my food and the sustainability of my food, and I want to know the farmer and name the cow on the plate, I would also suggest to you that you might think about your medicine in the same way, that localizing your medicine has really a great significance in our future well-being, in my opinion. So that's a lot of the work I do, actually, is trying to help people to connect better to nature, to plants, to see plants as useful and viable entities for them to be able to grow their own food and medicine, to harvest, to make some things. It doesn't have to be complicated. It doesn't have to be, you don't have to have a lot of land. So that's what we're going to look at today, actually, is some wild weeds. So the foraged pharmacy. So it could be a pharmacy with an F, because we're moving towards that kind of food medicine interface. And so let me see if I can get this screen to go forward. There we go. The first food medicine interface. I think you probably all know that. So I've actually chosen today to talk about just a few herbs, but to go a little bit deeper into them than perhaps you might suspect. So they often have more to share than what we see at the surface. And so stinging nettle is a great medicine. It's also a great food. It's very, very widespread around the temperate zones. So it doesn't like really extreme heat or really extreme cold, but it does grow above and below the equator, as in, northern and southern, because it's been moved around the world by people. Why has it been moved around the world? It's essentially a European native, although there are some species from here and from Asia. But the real Urtica dioica, as we see here, was moved around the world because it's so important to people. There's so much of value in it. It has medicine, it has nutrition, it has fiber. So you can actually ret the fibers, soaking and spinning out the fibers like you can with flax. And you can weave and you can make incredibly soft and beautiful, beautiful fabric out of stinging nettle. Yes, it's labor intensive, but that's actually fabric, real fabric, handmade plant material fabric. Yes, it is very labor intensive, but definitely doable. And then, of course, as a food, the leaf is a great food. It's packed full of nutrition. So stinging nettle is, for me now here on Vancouver Island, we're just finished the harvest season, really. Once you start to see these flowers on the plant, then you've definitely gone past its best. Really, the top 6 or 8 inches is what you want to harvest, not the top 6 or 8 inches of a tall plant, but actually the plant when it is 6 or 8 inches high. You might be able to cut and come again. It often will regrow. It matters because there is an accumulation of calcium oxalate in the leaf over time as it ages, and that can be a little bit harsh on your kidneys. And so not recommended, not poisonous, but not recommended to have a lot of stinging nettle that's older. And you can take a lot because it is a nutrition. You can think of it sort of like spinach with a sting. So anything you would do with cooked spinach, so spanakopita and soup and omelets and frittatas and all those sorts of things, you can definitely do with your stinging nettle. If you juice it raw, that is perfectly fine. But as you probably know, stinging nettle stings. A little bit closer, and here's a real close-up of it. So those stings are actually part of the medicine. Now, the nutrition is in the leaf because it's got these big, deep roots. It pulls a lot of nutrients. It's actually a hungry plant. It likes to grow around your compost, and where there's been kind of an old cottage site or something, that's where you'll find your stinging nettle. So the nutrition is in the leaf. But there's also the sting. And so and I'm sure many of you have fallen in the stinging nettle patch as a kid at some point. And they are, what you're looking at there are little trichomes or hairs on the stem, and they are made out of silica. Silica is what we make glass out of. So those are effectively like little glass needles, like little syringes, really, because that bulbous bit on the end is actually holding various different compounds that irritate when it gets under the skin. So those are things like histamine, bradykinin, serotonin, different molecules, which, by the way, we make as well in our bodies. And they're held in the plant there in that little sort of glass vial. And when that pierces your skin, it shoots it into you. And so now you have those, effectively those irritants under the skin, and they elicit that inflammatory response that you see when you fall in the stinging nettle patch. It gets red and itching and welts and wheals, and we actually call that urticaria. This is Urtica dioica, the Latin name of the plant. Urticaria is the condition of having welts and wheals on your body, whether it's from stinging nettle or not. It may be from other things that you're allergic to, because welts and wheals come up when you have histamine release in the cells of your body. It could be pollen or milk or something like that. You get some kind of like skin rashes with, especially with that kind of raised, swollen markings on the skin. And some people can even like write their name or write ABC on their skin, and it'll come up with a welt where you've written. It's that kind of inflammation of the skin caused by histamine in your skin. So what am I really saying? Stinging nettle has histamine in it. You sting yourself, you stick a little bit of that in your body, and it generates a micro-inflammatory response that damps your response down. So if you have allergic responses that give you the symptoms of things like hay fever, eczema, asthma, from allergies, that is a histamine response. And you can take, it's almost like a homeopathic or a vaccine of histamine through the stinging nettle, giving yourself a teeny tiny dose of that inflammatory compound, and that stops your body releasing it, so it damps down the response. So absolutely amazing medicine for allergies, for those histamine-induced allergies. And it's easy to drink stinging nettle tea. It doesn't taste bad. It's super easy to harvest, super easy to find, easy to harvest. If you wear gloves, you will be able to harvest a lot quite comfortably. It has after drying, it has a prickling effect, but not really stinging. But if you're brave, harvest at least some of it without gloves. Get stung. My husband would say that after the first 1,000 stings, it doesn't get any worse. And he would also say that when he did that, kind of in error one day, harvesting without gloves, kind of just going for it because he was away from home and whatever he just did. And lo, his significant arthritic inflammation in his hands that was quite disabling was gone. And I mean like gone overnight. He had throbbing red hands for a couple of days actually, but all the inflammation of the arthritis stopped. And that was many years ago. And he still stings himself regularly every year to maintain that, and it has maintained that. He's actually doing fine. And so old traditional treatment, flagellation, urtication actually is the name of this, to beat your joints where there's inflammation and arthritis, to generate a micro-inflammatory response that damps down your body's response. Very successful, difficult to sell to a patient. This is stinging nettle close up. So this, I'll just go back one. This is just a high resolution microscope. This is an electron microscope. So there you can see really close into those needles. As soon as you've blanched it, wilted it, dried it, they don't pierce the skin anymore. So you can still eat it. Dried nettle is a great medicine. You can throw it in your soup pot, throw it in your casseroles and stews in the winter, make tea with it all year. It's fantastic. But it's not just the leaf that's a medicine. There's a lot more. I've given you some references here. Some of you might have a science bent and be interested in following up. So I've actually put in a bunch of different diagrams throughout this lecture with references so that you can follow up if you want to. So this is from the International Journal of Molecular Science and suggesting that there is medicine and or nutrition and or something interesting, some interesting chemistry in the leaf, the seed, and the root. And indeed, that is the case. So I've already talked about the leaf. It's got all these kind of nutritional compounds. It's got vitamins. It's got chlorophyll. It's got carotenoids, which is the beta carotenes, antioxidants. It's actually got tons of minerals. It doesn't even mention that there. There's tons of minerals. Super nutrient. And it has this anti-allergenic property in the leaf. Slightly diuretic, slightly what we would call blood cleansing or detoxifying. Traditionally used in a spring cleanse when you're doing a detox in the spring. Stinging nettle is coming up at that time. It's fresh, it's green, and it is a depurative or a blood cleanser. But the seed and the root are also medicine. So the seed has really interesting oils which have an effect on the kidneys. The polysaccharides, those are big complex sugars, also affect the kidneys, and it regenerates and rebuilds kidney tissue. So we use the seed in people who've had progressive kidney failure. If your filtration rate is dropping and you're not clearing things properly through the kidneys, then we would use the seed. If you've had some kind of really significant infection or surgery or some such radiation perhaps to the kidney, then we would use the seed for restorative, sort of regenerative properties in the kidney. You can eat them. They're kind of dry and mealy and actually quite hard to find. I mean, you have to have a good patch. You can't just go and buy them easily in a health food store. We often use them in an extract form because it's a little bit more potent, a little bit easier to ingest on a daily basis. And then the root. The root is an amazing medicine. It has a whole lot of compounds, especially these lignans and phytosterols and lectins. And what they do is they work in the prostate gland. So they actually help with a sort of drainage, if you like, a detoxification of the prostate, sort of like removing stagnation, removing congestion from the prostate. So if you have benign prostate enlargement, if you have prostatitis, then it would be very indicated. But they also help to bind some of the hormones so that if you have a hormone-driven prostate enlargement or you're heading into prostate cancer, there may be some value in using the roots. So stinging nettle is an amazing medicine. It does all these different things. And I've given you another reference here, but you really just have to put stinging nettle into a search bar and you'll find a ton of good stuff. So again, the leaf is nutritive and blood purifying or blood cleanser, anti-allergenic. The seed is working on the kidney, the filtration rate, glomerular filtration rate, and then the prostate decongestant for the root. And I've given you the reference for that because that's something that, you know, is... This reference is suggesting that it's comparable to finasteride, which is the drug that's given for prostate enlargement. So I think that's quite a significant statement, and it's a fairly current piece of research, 2024. So a couple more things about stinging nettle, we'll move on. This is just sort of summarizing some of the anti-cancer activity. Now, I don't expect you to understand all of these acronyms, and I'm not going to explain them all, but all that to say that the leaf aerial parts, the tops of the nettle, have extensive research as anti-cancer agents to reduce cell proliferation, that's the replication of the cells, and to increase something called apoptosis, which is the death of cells. Now, let me just give myself the pointer here. That's, I think, what I want. So apoptosis is the programmed cell death that should happen when cells are done and need to leave the scene of the crime. And so cancer cells don't do that, and we can induce that with stinging nettle. There's studies suggesting in lung cancer, in bladder cancer, prostate cancer, and various blood cancers, even colorectal and breast cancer, you can increase apoptosis. That means cancer cells die off. You can decrease proliferation. Cells don't replicate as fast. And then this study, the reference is coming up in a moment, but the study is giving the actual pathways here by which those mechanisms are coming about, by which those actions are coming about. I work in the cancer field. This is incredibly exciting. Stinging nettle. Everybody's weed in their garden, most people have some stinging nettle around. It's really common. And look at all the things it can do. So here's the reference for that. Anti-cancer properties and other systemic health benefits. In vitro, that's in the test tube, all the way up to clinical trials. So really saying in human studies, this has been validated and verified. So I find that incredibly exciting. Yay for stinging nettle. Now, I do invite questions into the chat. I think that they are being collated in there. And so if you have a stinging nettle story or comment or question, that's a good place to go. Here's the last slide on stinging nettle. Obviously, this isn't my slide. I found this in one of the studies, but I thought it summarizes a lot of interesting things. Here's Urtica dioica extract, UD, Urtica dioica, stinging nettle extract. And then in this picture, they're suggesting giving it by injection. I don't do that. I'm not injecting herbs into my patients. This is all given by mouth, whether it's tea or tincture, or maybe a salve or something, but I'm not doing injections, just so you know. But in the research, in the studies, they have found all these different body systems, all these different things like antimicrobial action, protecting the liver, anti-inflammatory action. There's the prostate again. This is the kidneys, reproductive health. I mean, like, wow. I think this is a herb slash food that everybody should grow. It's so easy to grow and it looks after itself once it's established. You don't really even need to weed it. It'll just grow. It'll do its thing. And so I feel like everybody should make space for it. Last couple of words on stinging nettle. You can see I get on a bit of a roll with these things. It is in its own botanical family now, the Urticaceae, but it used to be in the Cannabinaceae, the cannabis family, separate male and female flowers, just like cannabis. So if you're looking for seed, make sure that you're going on to the female flowers because you can find the old, dried up, spent male flowers and think you're picking something useful and you may not be. But also interestingly, it has those same fiber properties that hemp has. And so that's kind of an interesting correlation there. You definitely can't get high from stinging nettle though. So last things there. I think we're done with stinging nettle. Yes, we're going to move on to another herb. Octium lapa. This is burdock, another one a lot of people love to hate. But isn't that beautiful? I mean, we don't often get that up close and personal with our weeds. We're usually too busy yanking them out. And so I suggest I give to all my students here that come to the farm and do long stay programs with me, they all get given a hand lens, a times 30 hand lens actually, with an invitation to get up close and personal because the plants are so beautiful. So yes, that's a weed and it's faintly annoying in the garden, but very annoying on your good wool clothing when those burrs get stuck there. But isn't that beautiful? So burdock. So again, I'm trying to give you some references in here because sometimes you're like, wow, really, this is too good to be true. Well, there are studies. So Arctium lapa burdock root has a multitude of active constituents, including and then a whole lot of different compounds that they suggest. The phenols, the lignans, volatile oils, through the various plant parts. So that means there may be some in the leaf, but actually in burdock, most of the medicine is either in the seed, which is rarely harvested, it's a real nuisance to harvest, or in the root. And in the root in particular, we have these fructose-like inulin. This is sugar, big, long sugar molecules. They are part of the medicine. Of course, they feed your microbiome. They're good for the bowel, for the gut flora, and that has a a ripple effect, if you like. So when your gut flora and your microbiome is well fed with these long, complex plant sugars, that they can ferment into the kind of molecules that the gut flora wants and your gut lining cells want, then your gut lining cells are healthy and strong and intact, and you don't get crossing of food particles into the bloodstream inappropriately. You don't get food allergies. You don't get autoimmune diseases. So actually, what I am really saying is that the root of burdock can be used to as an almost like a nutritive to the bowel, to the gut flora, so that they are healthier and better balanced, doing their job better. When the gut flora do their job better, your whole, not just the material that's being fermented in there, but the gut lining is healthier. The structure of the gut is better. And so this plant is used in leaky gut syndrome, in inflammatory bowel disease, in irritable bowel disease. These are all conditions where the microbiome is really important. And so this plant, it's a root, and there's sugars. And so we actually want to just make tea, simmering it because it's a root. You need a little bit of heat with that, or maybe even grinding it, maybe taking it in the form of gobo, which is the Japanese burdock root that is cultivated for eating. So if you think burdock is one of your annoying weeds in the garden, try reframing that as, yes, it's a great medicine. The root's a bit gnarly and knobby, but if you really want it as a food, go to gobo, go to the Japanese one, which is just bred to have a bigger, slightly sweeter, less rustic sort of a root. But as a medicine, this is a really powerful plant, and we absolutely harvest it here and absolutely use it in the clinic for all these things. It has anti-cancer properties, anti-diabetic, it balances the blood sugar, anti-allergenic, anti-inflammatory, antimicrobial, and numerous other beneficial properties. So this is definitely one of our power medicines. Now, they claim in this study from 2024 that it has aphrodisiac properties. I will say that's not how I've thought of it in my practice, but maybe they have research I haven't read yet. But anyways, all that to say, it's a blood purifying herb used in the spring detox. It's a nutritive herb in a food form. It's a microbiome nutrition. It has strong anti-cancer activity and really easy to find. That is a first-year burdock. It is a biennial. It is an Asteraceae family, a daisy family. It has that thistle-like head. And it has this basal rosette in the first year that doesn't amount to a great deal. And then it's laying down a big, deep taproot. That's what you're going to harvest at the end of the first year or the beginning of the second year. But you don't want to wait until it's flowering and going to burrs because it's spent that root. It's a biennial. It'll be finished. In that root, here is a bit of a breakdown of some of the nutrition, vitamins, minerals, amino acids. Now, this is supposing that it is grown on good soil. So if you have depleted soil, mineral deficient soil, then you won't get those minerals into the root. But it should, in good growing circumstances, be quite almost like a sink for nutrients. Kind of like the stinging nettle, they take up a lot from the ground around, which does mean if you're growing it in any way for regular harvest that you will need to feed that soil and put that nutrition in. And again, with this one, it's a biennial. So your stinging nettle, if you're not harvesting roots, you can just go back every year in the same patch. It's fine. But with this one, it's a biennial. You'll be digging that root and then leaving some to set seed so that you can get the following year cycle. There it is coming up. Now it's flowering. And so this is a second year. I would say that's a bit of a scrawny looking one. Some of the ones here are pretty lush and green. And here's a few of the things that are known in the literature, in the research for burdock root, for what it can do. Again, there's a few things like hair growth is something I personally haven't seen in my practice. I'm not entirely sure how that's going to work, but I do think that all of these other attributes that it's being given here are definitely supportable in clinical practice in empirical herbal medicine. So yes, a plant that's quite annoying because it does spread, and it spreads by those little fruiting bodies grabbing onto you and going for a walk, dropping off wherever you take your trousers off or leave, shake the mud off your boots, then they're going to be spread that way, of course, on animal fur, and presumably spread around in hay bales and such. Um, in the um, in the research, there's a lot of good studies about managing the blood sugar and the consequences of elevated blood sugar. So chronically elevated blood sugar leading towards prediabetes or type 2 diabetes is something that is eminently treatable with burdock as part of the story. Obviously, diet, as exercise, all those things, and other herbs too. But the root of burdock has a very particular benefit in what's called metabolic syndrome, which is that pre-diabetes state where all the blood markers are directing towards early stage diabetes, but you're not quite there yet. The burdock root can help to stabilize that blood sugar and reverse out of that trend. And it also helps to reverse some of the oxidative stress that comes from high blood sugars, and literally can inhibit the progression of obesity. So it is absolutely part of a lifestyle treatment plan and or an intervention in somebody who has metabolic syndrome, that is weight gain, high blood sugar, high blood pressure, high blood fats, because the burdock is also working on your lipids. Here's your dyslipidemia, your disordered blood fats, cholesterol. So it's working on all of those things. This is your fat cells, so it's working to down-regulate some of the manufacturing of body fat. It's down-regulating inflammatory pathways here, and even over here, you make some cholesterol, you don't want it to get oxidized, so the burdock can help there. It's a bit like nettle. It's a master herb, and that's why I'm talking about these ones. Again, super common. Everybody loves to hate on them, but they are really powerful medicines that do so many interesting things. And so there it is. See those little hooks? See right here, these little hooks? That's how it distributes its seeds around. So it's a thistle-like flower. So there's a multitude of flowers there. That's an inflorescence. And each flower has a seed, sort of like your dandelion flower, right? Where each little parachute is a seed. And here, each little seed has a hook. Look at this. And so they hook on you and get transported around. Some people suggest that was the inspiration for Velcro. I've also heard that about cleavers. I'm not sure the truth of which one, but it certainly sticks like Velcro, I can say that. Yeah, so another familiar friend. Plantain. Not the banana, of course. Plantago lanceolata, the lance leaf, the narrow leaf, the ribwort plantain. So this long leaf with the kind of veins. You can see the veins really well here. And here's the flower of it. It's on a long stalk, and then it's got this multitude of little tiny flowers. It's wind pollinated, so they're not very big, showy flowers. They're not for the insects. That's the lance leaf or lanceolate or ribwort or narrowleaf plantain. This is the broadleaf plantain. This is Plantago major. So that was Plantago lanceolata, Plantago major. They are interchangeable in medicine. We use them both. In fact, this was, we had a big harvest on this today, and I have a big dryer box with heat and fan and so on, and it's pretty much filled right now with plantain, Plantago major. You have to wait a bit in the spring to let it get up out of the mud. It's kind of a bit flat growing, and so you can see here, you wouldn't be picking that one. It's a bit mucky. You'd be picking these more elevated leaves. Plantain has enzymes in it. When you harvest, you have to snip each leaf with a pair of scissors, very gently laying it down with a soft touch into a basket where it can lie flat, not into a bag where it gets jumbled around. And when you come to lay it out to dry, you lift it very gently, very, very soft touch with plantain. Otherwise, it bruises and browns and starts to degrade in quality a bit. There's the flower again of the narrow leaf. Quite pretty when you get up close. Again, one of those weeds we dismiss. We just mow it. It has a central basal rosette growth form, and so you can cut and cut on the lawn, and it'll just keep coming, and we get annoyed about it. But when you really look, that's actually quite lovely. And what does it do? Well, maybe you could just say, what doesn't it do? It's like again a medicine chest in just in that one plant. The leaf is the most common part harvested and used. It has multiple different constituents, including things called flavonoids. They tend to be antimicrobial, they tend to have antioxidant activity. And so they promote wound healing, they have anti-cancer activity, anti-inflammatory. This is a big part of the plantain story. The flowers, we don't usually harvest the flowers, but there are some medicines in there that are anti-inflammatory and even anti-parasitic. The seed is harvested of a different type of plantain. You may have heard of psyllium, or you may have heard of metamucil, which is psyllium. That's a seed from an Indian plantain, Plantago ovata, and that's slightly different than what we're talking about, but it's a common product. People know metamucil, but they don't quite realize it's from a type of plantain, from the seed. There is medicine in the root, not routinely harvested, not really available in commerce or trade. It is mostly the leaf or the tops, the aerial parts that are used. And certainly that's what we harvest. I always harvest my own. It's so prevalent. And it is an easy harvest. I have a lot of volunteers in my botanic garden and they love harvesting, but I have to make sure that it's something that they can realistically and reasonably do. And so I have a number of elderly people that garden with me in the week. And so as sort of part of the volunteering is the horticulture therapy. So we have to pick and choose. And if they can get down on their hands and knees, they can harvest this one quite readily. They don't need big tools and such. So we do pick it because I can't buy a really good quality. It's always brown when I buy it. So I put in the reference again here. This is from a 2022 Journal of Chemistry, just to show you that there is scientific literature and research. There are the constituents. Again, there are the key actions. So antioxidant, which means anti-aging for tissue and cells, antibacterial, wound healing. A lot of people know this even in the garden as a herb for sort of owies. If you've had a bruise, a cut, a bash in the garden, grab one of these leaves. Make sure it's clean, run it under a tap if you want, bruise it a little bit. Maybe you go over it with a rolling pin or a bottle or something to bruise it up a bit and then wrap the wound up with it and it will actually promote the healing. It has some even cytotoxic properties. That means it can kill off, again, bacteria, parasites, and possibly even rapidly replicating cancer cells. And it promotes healing of ulcers. Wow, all of that. Who would have thought in plantain? Last but not least, in my detailed review, I have a couple more after that to whiz through, but just the last one I wanted to talk about a bit more detail is another family favorite, Rumex crispus. This is yellow dock. Now you can use curly dock. You can use a lot of different docks. To be clear, this is not the same as burdock. Burdock, which we've already discussed, is in the Asteraceae or the daisy family. That flower head looks a bit like a thistle without the thorny bits. Yellow dock is in the Polygonaceae family. The rhubarb and sorrel and buckwheat and Japanese knotweed family. That's where the yellow dock and curly dock and crispy dock and all the docks, they all fit into the Polygonaceae family, not the same as burdock. This is one of the problems with the common names. So let's talk about Rumex. So again, a very, very common plant. It's a perennial. It has a decent taproot. It can get down a couple of feet actually if it gets established. And we definitely harvest this one here, and then we scatter seeds liberally because we want it again. So we do replant this one every year. So to date, over 268 constituents have been identified from over 29 species. And then they list some of those constituents. Now, honestly, plants have hundreds of constituents. So even if you have at home a bottle of lavender essential oil, it's not just a thing. That is actually a couple of hundred different chemicals even within that. And that's just one thing in lavender. So you bet there's a lot of phytoconstituents, phytochemicals out there. They all do interesting different things. In this particular plant, it is again the root that is the medicine. And it is used as an anti-inflammatory with a bit of a focus around joints and around skin. So arthritis and eczema, maybe gout, maybe psoriasis. So skin and joints is particularly where Rumex root is used as an anti-inflammatory, little bit antioxidant again. A lot of plants are, to be honest. And I think that just speaks to us needing to have a wide array of plant material in our diet and in our medicine so that we get that full spectrum of all the different antioxidants that are available to us, because there's a lot. You think of them in your blueberries or maybe your tomatoes, but they're actually in lots of plants. And a lot of anti-cancer action in Rumex. A little bit of a clinical risk if you eat a lot of the leaf. So sorrel, French sorrel, is the one that is classically eaten. But if you do eat something like a yellow dock or sheep sorrel, Rumex acetosella, you don't want to take a lot of those because of oxalates in the leaf can irritate the kidneys. And in the root, in some of the plants, not all, but some, they have these anthraquinones, which are a group of compounds which are bowel stimulants. So senna has anthraquinones. That is the strongest of them all. The Rumex are very mild, but if you are prone to loose bowel, maybe you have inflammatory bowel disease, you don't necessarily want to take these plants because they could irritate a little bit and cause a little inflammation. So those are the major actions of Rumex, crispus, yellow dock, and Rumex species in general, just the whole 29 species of them. This is a different paper, actually, 2025 paper published in Food Science and Nutrition Journal. And again, this is showing some of the pathways, some of the mechanisms, some of the things that that yellow dock can do. And this is mostly about cancer, to be honest. When I look at this, I'm seeing cell cycle arrest. I'm seeing synergy with chemotherapy. I'm seeing apoptosis, which is programmed cell death, what cancer cells should be doing that they don't. I'm seeing anti-inflammatory action, signaling pathways. This is all cancer speak. And so this is actually really a study demonstrating the benefits of yellow dock in cancer care. This one, there was actually, honestly, I will say that there was so much research on these herbs, I didn't know where to stop. I will stop in a minute so that we could take questions, but there were hundreds of studies, so I just picked out a few that I got my attention. So here's one with a type of dock I haven't worked with, actually Rumex dentatus, but it's from the Middle East, this particular species, and they were suggesting that it can mitigate paracetamol, that is a Tylenol-induced liver damage. And Tylenol is a massive toxin to the liver. We know that Tylenol poisoning causes liver poisoning. And so the treatment, the standard medical treatment in emergency facilities in hospitals in Europe is silymarin. That is milk thistle. So what they're suggesting here is that the yellow dock, the dock, the Rumex dentatus, was as effective for Tylenol-induced liver damage as the milk thistle. I think that's quite extraordinary because milk thistle is extremely high selling, extremely popular for this sort of thing, for healing the liver. And this is suggesting that dock may be as effective. Well, that would be a game changer because of price points, because the silymarin is highly purified and concentrated into capsules. It's difficult to get enough out of your milk thistle seed, which is the source, but dock, root, that is perhaps a lot more available. So yeah, in terms of sustainability, we might do better to grow dock than to grow milk thistle. Just food for thought. This was a study in triple negative breast cancer. Now, this isn't in humans, this is in cell lines, it's in a lab. Another Rumex, I don't know, Rumex vesicarius. And again, this is from a Middle Eastern study. They do a lot of research into plants out there. And so this was actually enhancing the efficacy of a medication. This is a drug used to treat cancer, sorafenib. It's a new era cancer drug. And so here, in test tubes, in cell lines, giving an extract of this dock increased the benefit of the drug in the cell cancers, in the cancer cells. And then it talks about the mechanisms. And so this is exciting research. This is beyond just sort of food medicine. This is into clinical practice. But to show you the sort of scope and scale that a herbalist will work, these are the kinds of things that we look at as we're researching plant medicines. So I had full intention of providing more herbs in this talk. However, as I got into it and started looking at the current research, I was searching for everything from 2022 forward, and I started to find so much that I decided to just do those few herbs. I have a couple of others, pictures of a couple of others I'm going to just whip through for fun, and then we're going to open up for questions. So this is horsetail. This is the sporophyte phase, the reproductive phase, and it will be followed shortly. Oh, there it is again, close up. Beautiful. Kind of looks like a strange kind of mushroom, doesn't it? This is expressing alternation of generations for those of you that like the botany. And behind it here now, the green, this is the vegetative phase. This is Equisetum arvense, horsetail. There are a number of species of Equisetum, and they all date back to the dinosaurs. They were giant. You think you have a problem with horsetail in your garden or fields? They used to be tree-sized. So they are filled with minerals, filled with silica, and incredibly nutritious. So I harvested this today in my property. It looks just like that when I harvest. The little branches are pointing up, not drooping down. And that's when you harvest your horsetail. I put just one slide about horsetail. Again, there's much to say, but this was about wound healing because it's very, very good for knitting up connective tissue. And connective tissue is your skin and the muscle and the fibrous tissue. It's also the tissue of the lung, the tissue of the kidney, the lining tissues of the gut. This is all connective tissue. Even nervous tissue and bone are types of connective tissue. And so horsetail can literally help to heal and rebuild and restore those. So we use horsetail in people who've broken bones or had bones cut through surgery, and so they need to heal a bone, or who are having metastases to bone where you want to strengthen it, or bone thinning like osteoporosis. We would use horsetail. We would use horsetail for poor quality and condition of hair, nails, teeth, skin. I was recommending it today to somebody for an inflammatory lung condition. So yeah, horsetail, it's been around for so long. It's such a weed for most people. And my last plant I'm going to mention, and I'm really just going to whiz through this one because I have a few lovely slides to show and then we're going to stop. This is dandelion, of course, the fly's eye view of dandelion. Taraxacum officinale. Now, when you see this this name, officinale or officinalis, what that tells you is that when this plant got its Latin name, which was from probably the late 1700s, Linnaeus, and 1700s somewhere, it was official in the repertoires of herbal medicine, in the sort of books that were being used, the pharmacopoeias of the day. If it says officinale or officinalis in the name, then it was an official medicine. It was a recognized, valuable medicine of the era. And so that's a little clue for us in the names that they had value, and probably still do. So here you can eat the flower head. Now, not the entire head, because this part here, the involucre, is really bitter. It's got all that latex in. It's not pleasant. But all these petals, this is a daisy family. Everyone's a separate flower. You can pluck them out. You can easily see down here where they're so fresh and bright. You can even just snip those off into your salads, your fruit salads, decoration on the plate. They're quite lovely. The leaf, of course, is edible, and it's used sparingly because it's quite bitter, but it can be used in salads and it can be added to juices. And it's very good as a nutritive and a blood cleanser, spring green, and also a bit of a diuretic. The French name for this herb is pissenlit, which means wet the bed, because it's a diuretic herb. The root is the other big medicine. It can be chopped up, dried, roasted, and used as a coffee substitute. Quite tasty, no caffeine. But it also has a decent amount of bitterness, like coffee. And like coffee, it can stimulate the liver and it can make you get your bile flowing. That helps you digest fats and fatty meals. And so it's good for indigestion and maldigestion, malabsorption. So again, such a common weed where I live. We have fields and fields and fields of dandelion in the spring, and then it goes over to seed, and it's quite messy for a while, and then it just kind of disappears, and it's still there in the ground, growing away, green, happy. But for a couple of weeks or a month, even in the early spring, it is just beautiful. So it's everybody's favorite, even the ponies. And that is it in its seed head stage. So the pappus, the little parachute, each one of those is a seed ready to grow another dandelion in your lawn. And look at that. I can't believe it. I'm on the hour. I'm never on time with ending a lecture, but that is my last slide. So I'm going to leave it there for a moment. So anybody who wants to take the contact is welcome to. Um,
Thank you
and
so much. Yeah,
yeah, my pleasure.
yes,
My
thank you so
pleasure.
much. This was fantastic. I so appreciate your talking this through. Yes.
Oh
Um,
my goodness. You just sort of push the button, Leslie. And there it is, because there's so much to say about every herb. They're all food, medicine, interesting. We didn't even get into stories and mythologies and all of those things, but
ah,
yeah,
yeah,
yeah.
that's great. Well, Tim, do you want to ask your questions at the beginning here, or maybe you start through the some of the questions if you don't mind? So it's not just me.
Okay, I thought I was spared from that.
Well, you asked a
No.
question.
Sure. Yeah, I was wondering about plants in the families that you discussed. So, specifically with nettle, I was asking about Canadian clearweed, which doesn't have the sting, but I'm wondering if it has other similar benefits, the medical
Mhm.
benefits that you mentioned, and the culinary benefits. And Leslie also mentioned similarly Pennsylvania pellitory, which is another related.
No,
Oh,
I'm
you have
saying nettle.
pellitory? I want
Yes,
pellitory.
yes.
I use pellitory, but I'm not growing it, and I would love to get some of that because that's a great medicine for the kidneys. But your question is a really interesting question. To what extent are different species interchangeable? And in some cases, they really are like the plantain, Plantago lanceolata, Plantago major. they certainly look different in whole leaf form, but biochemically, they're really one and the same. And yet you think about, in the gardening world, you think about, you have the difference between, a cucumber and a melon, and they're in the same family, but they're really
Right.
different. So then are they the same genus? And sometimes they are, but they're still really different. So Rubus idaeus is your raspberry, and up here we have Rubus spectabilis, which is thimbleberry. Super looks like it, tastes like it. It is an interchangeable plant. But then you have something like ribes, which is the blackberry, and that is also interchangeable. And so you can't make a blanket statement, I think is what I'm trying to say. It depends on the biochemistry of the plants and how that matches. It also depends on the more esoteric properties, the energetics or the constitutions of the plant might be a factor. But sometimes, for example, I don't often want to use, maybe I should start that sentence again. I do sometimes want to use golden seal, but golden seal is endangered. So I often am thinking I shouldn't use it. It's not the best choice because of its special features of being endangered, but it's a great medicine. So are there then things I could substitute? Well, there's nothing quite like golden seal, but are there a couple of herbs I could put in together to make something equivalent? So that's sort of the art of herbal medicine. So I'm giving you a bit of a long-winded answer because there isn't a straight answer. In the case of nettle, you probably can use any nettle. In Chinese medicine, they use Urtica urens, and they use it in many of the same ways. Does it have all the same properties? I don't know. If it doesn't have the sting, it won't have the anti-allergenic properties because it
Yeah.
won't have the histamine and the serotonin and the other molecules that generate that anti-allergenic quality. It will still have nutrition. It will possibly still have the value in the root or the seed because that is different. But yeah, it's plant by plant.
And in the nettle, how do you eat the root or the seed? Are you talking about just actually eating the seeds, or do you use a tea, or what? How does that work for the
Yeah,
nettle?
so they're not really part of the food spectrum like the leaf is. So
Right.
the seed is dry and a bit it's not exactly woody, but it's kind of papery and not palatable, and so you wouldn't do that. You could perhaps put the seed into a pepper grinder, a salt grinder, and grind it fresh onto your plate. It might, I haven't done that, but I'm just guessing. But typically, we make an extract with the seed. That means a tincture, that means an alcohol extract, or conceivably some other solvent, but it needs to be sufficient polarity to get the constituents out. There are fatty constituents in seeds. They need a solvent. They don't come out well in water. So a simple tea doesn't do much. You would be
Right.
better to cook it into a dish where there's a bit of oil in the pan, and then you throw a tablespoon of the seeds in while you're doing your stir fry or something. Um, but then you're questioning how much volume are you getting? Is it going to give you any sort of value for the effort?
Right.
Because yeah, so the seed is more specific as a medicine, and the root, similarly, what you're looking for in there is does need a solvent, and so again, eating it isn't really what we're suggesting for the root. So the leaf is the food slash medicine, and then the seed and the root are specifically medicines for very specific reasons, whereas the leaf, anybody and everybody can be ingesting that in the world of food without having to even call it a medicine. And then if you have a condition it could help, then it will do that too.
Right. Okay. Okay.
Mm. Hmm.
Um, and Tim asked also, is burdock root safe for the leaky gut IBD from immunotherapy treatment drugs?
Yes, the burdock root has these fructo oligosaccharides, these great big long fruit sugars that just help to feed the good bacteria. And that helps with managing any bowel infections, for example. if there's any inflammatory bowel disease and or di things like diverticulitis, where you've
Yeah.
got inflammation in there. It's non-specific. It's not for a disease. It's for better bowel health, structure and function, actually, because by creating a better microbiome, you're managing the pH level better. And when you manage the pH level better, there's literally a bunch of proteins that hold the cells, the lining cells of the gut together, and they respond to pH. So if you have the right pH, you have good integrity, good resistance in the gut lining, and things don't pass that shouldn't, so that it can function better. So yes, absolutely, burdock is completely indicated there and really safe.
Right. Okay.
Mhm,
Okay.
mhm.
Tim, do you want to ask the lead question?
Sure. Again,
Mm,
on burdock, you had said that it was uptaking a lot of minerals, and one of the ones in your list was lead.
yeah.
And when it comes to heavy metals, when plants are very good at taking them up, we have to be very careful about what we do with a plant. So I was
Yeah.
wondering if you're suggesting soil testing and if it's other heavy metals also.
Yeah, that was well spotted. Absolutely, yes. It is an issue in the industry of herbal medicine. And I would say that it speaks again to know your farmer,
Uh,
know the land your herbs are being grown on. Maybe try and find a herbal CSA to be involved in the growing of the medicines that you're taking. It is an issue. It's absolutely an issue. If you grow food or medicine on contaminated land, it's going to end up in your food. And some plants are chelators. So burdock takes up a lot of minerals. It's partly why it's good for us when the minerals are good for us. St. John's wort is used in remediation of toxic sites because it accumulates cadmium.
mhm.
That does beg the question. You can't then bury it because it'll release again. You can't burn it because it'll release in the air. What do you do? I actually don't know the answer to that, because they tend to just grow the plant and let nature do it. They just leave it when they grow it as a remediation. They don't even harvest or cut or anything. But bad product does get in the marketplace. There absolutely can be contaminants that come in because somebody didn't do soil testing or excuse me, or there was an upstream leakage that's come on your land you didn't know about, or what's in the rain. You can be certified organic, but what's in your rain, all of that. So in the industry, when you purchase herbs from a third party that you don't know the farmer, you're buying from a broker or a wholesaler of some sort, then your herbs should come accompanied by a sort of a passport, and it's called a certificate of analysis, C of A. And at the retail level, you going in your health food store, your local Whole Foods, you're not going to get that. But if Whole Foods or some brand is manufacturing a product and selling it on in that way, then they will have at some point looked at the certificate of analysis to say that this batch of echinacea, this batch of burdock is free of contaminants, is free of heavy metals, is free of radiation residue, is free of E. coli and salmonella and all those things. And there's a standard document that's used in the industry, and it is an industry. It's a multi-million-dollar industry. So you bet there's some bad players out there and some errors and omissions and things that happen. It's nature,
Right.
organic, right?
Yeah, and then again with drinking nettle, actually, one of the people said, they happily drink nettle tea and enjoy eating the leaves regularly, but I'm unsure as to how, if, or when an injection or pill might be in order. I mean,
Well, yeah, I
yeah,
wouldn't do injections. Let's leave that out of the equation.
yeah.
But a pill would be in order. So here's how I would sort of scale it, if you like. Maybe I'm just going to stop sharing my screen here now. I think we'll come back to this. So I love your picture, by the way, Leslie.
Uh, yeah.
Big toad
That's my
there.
tree frog. That's on my beehive. Okay.
Okay, yeah. So, so sorry, can you give me that question again?
So yeah, so he's asking, or she, I don't even know, is says, how does the format of usage and amount impact the benefit of stinging nettle? I happily drink nettle tea
Right.
and enjoy eating the leaves regularly, but I'm unsure how,
Right.
if, or when an
Yeah.
injection, pill, etc., might be in
Yeah.
order.
Yeah. So here's how I would work that through. If you have a condition that you would routinely treat yourself, you might go to the drugstore, but you would choose something yourself off the shelf for your ache and pain and ailment. Then you can do that with herbs. But
Right.
if you would go to the pharmacy and ask advice at the counter, and maybe get one of those products that is behind the counter but doesn't need a prescription, then I would suggest that you should get some advice from somebody, whether it's a nutritionist, whether it's in your local health food store, they're quite knowledgeable, or a professional trained herbalist. And certainly, if you have a condition that you would go to the doctor for and ask their advice, then you should consult with a healthcare professional, whether that's a herbalist, a nutritionist, a naturopath, whatever it is that is available to you. But that's kind of how I scale it. Like something you would treat yourself at home with a home remedy or something from the drugstore that you would choose for yourself. Do it with herbs. It's great. But something you would need advice for, get professional advice from someone who knows about the herbs.
Yeah. 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 And I think the last question, Tim, is yours again. So yeah, comfrey.
Sorry, I've got so many questions.
Oh, no, it's great. I love it.
I was wondering if you had any comments on comfrey because some people find it controversial to consume it, but a lot of people will use it as a poultice for bone healing. I've consumed it as tea, but I'm told that you shouldn't be consuming it.
Yeah, it's a great question. Thank you for bringing it up. One of the many herbs I could have talked about but didn't. It is a concern. It is a genuine concern. Drinking it as a tea probably isn't really a concern. Using it topically is fine, by the way. Topical is just like not an issue, and we'll talk about why it's useful that way in a moment. Taking it as a tea is probably not really a concern. Taking a tincture, that's an alcohol extract, or eating it, grinding it up into a capsule, that would be a concern, but it takes a long time to be a problem. So you don't necessarily realize for months or years that there is an issue brewing. And what it does is it causes a condition. There's a compound in the plant, an alkaloid, not very water soluble, doesn't come really in tea very much, more into a tincture or if you eat the plant. And that alkaloid causes a condition called, bear with me, hepatovenoocclusive disease. Hepato means liver, veno means vein, occluso means blocking, to block a vessel. Disease, hepatovenoocclusive disease. It blocks veins that drain out of the liver. So you get this huge liver congestion. But the liver has a lot of spare capacity and some room to grow a bit before you know there's a problem. So you can get quite far down the road of liver damage before you realize. And that is not scaremongering. That is a known thing. So we don't use comfrey internally. Really, if you follow the rules, I would say not at all. But if you push on the edges of rules, then what I would say is you can use a comfrey tea internally for a short time, 2 to 4 weeks, in somebody who is not pregnant, who has no pre-existing liver problems, and is not taking drugs, street drugs, or prescription drugs that could compromise the liver functions. So with some sensible caveats, you can use comfrey internally in a tea, although it's not recommended in the literature. Now, why would you even do that? So the reason is because there's a compound in comfrey. There's two things in comfrey that are medicinally interesting, and they both come out in water. And one is mucilage, which makes it slimy. So that's really useful if you've got dry, cracked skin, for example. You can put comfrey slime on. If you've got a big scrape, you've fallen off your bike and skidded down the road and got those big sort of abrasions, not a deep cut, but a lot of like surface stuff, then it can heal over with comfrey. It soothes it, takes out the burning. If it's a puncture wound, you have to be careful if there's any material stuck down in there. Comfrey will heal the surface so fast that it can actually trap dirt in a wound. So make sure a wound is cleaned properly first. Comfrey is called nip bone in the folk literature because when you take it internally, or if you poultice over a broken bone, it helps with cell proliferation and knitting up the bone. It literally helps the bone heal. So I would consider comfrey in a tea in somebody who's not pregnant because the infant's liver can't take it at all. That's definitely a no-no. Somebody who's got no liver disease, no liver compromise, and they break a bone. For 2 weeks, a month, I might give them a comfrey tea. The leaf is safer than the root, so and still just as effective. But I would also have them, for example, take comfrey root or leaf and make a really strong tea and then bathe the area. So if you've got a removable cast, then you can just do a soak. But even if you have a plaster of Paris cast, this doesn't work, but you can get your casts made in fiberglass and then they can get wet. And you can literally you can't see what I'm doing here, but I'll stand up for a second. If you have, let's say you've got a broken arm, right? You're going to put a big plastic bag and an elastic band here. And then you've got a cast. And you're going to pour your comfrey tea in here and sit with your arm in it, floating around in there. And then you take the bag off, let all the tea out, and then get a hairdryer and go down and dry it. And with a fiberglass cast, you can do that. You can't do that with a plaster cast. But that will speed up the healing dramatically. So comfrey's fantastic. There's also a whole story about comfrey in your garden because, of course, we talk about in the biodynamic farming methods. They use it in some of the soil amendment mixes that they use and making a vortex and going counterclockwise and all of that. That's with comfrey. Many of us make some kind of comfrey, I was going to say tea, some kind of comfrey soup in the spring, don't we? We leave comfrey leaves in water for a few weeks and make that smelly stuff that everybody likes. Comfrey's great medicine. It's not safe for everybody all the time, but it is good medicine.
Yeah. Well, we should let you go. Thank you so much for all of this. We really
I could go
appreciate
on
your
and on.
joining in. Yeah, no, it's so great. We really appreciate talking with you.
Yeah,
Thank you
yeah,
so
my
much.
pleasure. I just would love to say to everybody that I really appreciate everybody who cares about growing food and growing medicine and living a little bit closer to the land and noticing nature. That is my work in the world, is to help people to notice nature. And I appreciate you all for coming in tonight to let me share a little bit of my enthusiasm for the wild weeds.
Aw, thank you so much. Thank you very much.
Yeah, yeah,
Thank you. This was wonderful.
yeah. Happy herbaling.